Hello everyone, Dr. Alan Mandell here. Welcome back to my channel, Science of Healing. Today, I want to talk about something very important, something that can literally save your life. Many people use the terms chest infection and pneumonia as if they mean the same thing, but they are not the same, and misunderstanding the difference can delay treatment and lead to serious complications. Let's break this down in a simple, clear way. A chest infection is a broad term. It usually refers to infections in the airways, such as bronchitis or infections affecting the bronchi, the tubes that carry air in and out of your lungs. These infections are often caused by viruses, sometimes bacteria, and they usually involve inflammation, mucus production, coughing, and chest discomfort. In many cases, chest infections are mild and can resolve on their own with rest, hydration, and proper nutrition. Pneumonia, on the other hand, is much more serious. Pneumonia occurs when the tiny air sacs in your lungs, called alveoli, become filled with fluid or pus. This makes it extremely difficult for oxygen to enter your bloodstream. The result can be shortness of breath, high fever, chest pain, confusion, and extreme fatigue. According to medical research, pneumonia remains one of the leading causes of death worldwide, especially in older adults and people with weakened immune systems. Every year, millions of people hear the words, "It's just a chest infection," and breathe a sigh of relief. But what most people don't realize is that sometimes that same cough, that same fever, that same chest tightness can be the beginning of something far more dangerous, pneumonia. And the difference between the two can be the difference between recovery at home and a fight for your life in a hospital bed. A chest infection is often used as a casual term, but medically, it usually refers to infections like bronchitis that affect the airways. These airways are like highways that carry oxygen into your lungs. When they become infected, they swell, produce mucus, and trigger coughing. It feels miserable, but in many cases, the body can fight it off with rest and fluids. According to medical research, most acute bronchitis cases are caused by viruses and resolve within a few weeks without antibiotics. But pneumonia is not just a worse chest infection. Pneumonia is a direct assault on the deepest, most delicate structures of your lungs. It attacks the alveoli, the microscopic air sacs responsible for oxygen exchange. These tiny sacs are where life happens, where every breath turns into oxygen in your blood. When pneumonia strikes, these sacs fill with fluid or pus, literally drowning your lungs from the inside. Think about that for a moment. You're breathing, but the oxygen can't get in. Your blood oxygen levels drop. Your organs begin to starve. Your brain becomes confused. Your heart strains. Your muscles weaken. And in severe cases, your body simply cannot keep up. The World Health Organization reports that pneumonia is one of the leading causes of death worldwide, especially among children under 5 and adults over 65. In older adults, pneumonia is sometimes called the old man's friend because it can silently and rapidly become fatal. In the United States alone, hundreds of thousands are hospitalized every year with pneumonia, and tens of thousands die from it. These are not rare cases. These are real people who thought they had a simple infection. What makes pneumonia especially dangerous is how deceptively similar it can feel to a mild chest infection at first. You might start with a cough, a fever, some fatigue, but then suddenly you feel like you can't catch your breath. Your chest hurts when you breathe. You feel dizzy. You feel weak. You may even become confused or delirious. These are red flags that your lungs are failing to deliver oxygen. Chest infections usually stay in the upper or central airways. Pneumonia goes deep. It infiltrates the lungs at the cellular level. Scientific imaging shows that pneumonia causes patches of lung tissue to become opaque on X-rays, a sign that air spaces are filled with fluid instead of air. Doctors call this consolidation. To the body, it feels like suffocation, and the causes differ too. Chest infections are commonly viral, triggered by colds or flu viruses. Pneumonia can be viral, bacterial, or fungal. Bacterial pneumonia, especially from Streptococcus pneumonia, can progress rapidly and requires antibiotics. Viral pneumonia, including that caused by influenza or COVID-19, can also lead to severe lung damage. In some cases, pneumonia develops after a chest infection weakens the lungs, allowing bacteria to invade. Here's a shocking fact. Pneumonia can develop within 24 to 48 hours. Someone can feel fine one day and be in critical condition the next. Studies show that elderly individuals, smokers, people with diabetes, heart disease, or weakened immune systems are at much higher risk of severe pneumonia, but even healthy adults and young people are not immune. Another alarming reality is that pneumonia can be silent. Some people, especially older adults, may not have a high fever or severe cough. Instead, they may just feel tired, confused, or weak. This is why pneumonia is often misdiagnosed or detected late. The crucial difference is this: a chest infection irritates your breathing tubes. Pneumonia shuts down your breathing system. One is uncomfortable, the other can be catastrophic. And the danger doesn't stop after recovery. Research shows that pneumonia can have long-term effects. Survivors may experience reduced lung function, chronic fatigue, and increased risk of heart attacks and strokes in the months following infection. Scientists believe the intense inflammation triggered by pneumonia can damage blood vessels and organs long after the infection is gone. So why do people underestimate it? Because the symptoms overlap. Because we often think it's just a cough, because we believe our body will handle it. But pneumonia is one of those conditions where early treatment can save your life and delay can cost it. Modern medicine has powerful tools: antibiotics, antivirals, oxygen therapy, ventilators, but timing is everything. The earlier pneumonia is diagnosed, the better the outcome. That's why recognizing the difference is critical. If you have a mild cough, low-grade fever, and feel generally okay, it may be a chest infection. But if you have high fever, difficulty breathing, chest pain, rapid breathing, blue lips or fingertips, or confusion, these are emergency signs. Your lungs are struggling, your body is struggling, and you need medical attention immediately. Pneumonia is not just a disease of the lungs. It is a systemic battle that affects your entire body. When oxygen drops, every cell suffers. Your brain fogs, your heart races, your kidneys strain, your immune system goes into overdrive, releasing inflammatory chemicals that can damage tissues. In severe cases, pneumonia can lead to sepsis, a life-threatening condition where the body's response to infection spirals out of control. The difference between a chest infection and pneumonia is not just medical terminology. It is the difference between irritation and invasion, between inflammation and suffocation, between recovery and survival. And your lungs are silent heroes. They work every second of your life without rest. But when they are attacked, the consequences can be sudden and severe. Understanding this difference empowers you to act, to seek care, and to protect yourself and your loved ones. Never ignore persistent symptoms. Never assume it's just a cold. And never underestimate the power of pneumonia. Knowledge is your first line of defense. Awareness is your shield. And early action can save your life. When it comes to chest infections and pneumonia, medicine can save lives. But your daily habits can decide how strong your body is when the battle begins. The truth is, your immune system is not built in a hospital. It is built every single day, on your plate, in your kitchen, and in the choices you make when no one is watching. Inside your body, trillions of immune cells are constantly patrolling, searching for viruses, bacteria, and invaders. But these cells need fuel. Without the right nutrients, they become slow, weak, and uncoordinated. With the right nutrients, they become a powerful army capable of stopping infections before they reach your lungs. Scientific research shows that people with poor nutrition are significantly more likely to develop severe respiratory infections, including pneumonia. Deficiencies in vitamins like vitamin C, vitamin D, zinc, and antioxidants have been directly linked to increased infection risk and slower recovery times. Let's start with vitamin C, one of the most powerful immune-supporting nutrients known to science. Vitamin C stimulates white blood cells, enhances their ability to kill pathogens, and acts as a powerful antioxidant that protects lung tissue from damage. Studies show that people with higher vitamin C intake have shorter durations of respiratory infections and reduced symptom severity. Citrus fruits, strawberries, bell peppers, and broccoli are simple, everyday sources that can strengthen your defenses. Then there is vitamin D, often called the immune system's master regulator. Vitamin D activates immune cells and helps the body distinguish between harmless particles and dangerous pathogens. Research has shown that low vitamin D levels are strongly associated with increased risk of respiratory infections and severe pneumonia. Sunlight exposure and foods like eggs, fatty fish, and fortified dairy can help maintain healthy levels. Zinc is another critical mineral that many people overlook. Zinc is required for immune cell development, communication, and function. Without enough zinc, the body struggles to fight viruses and bacteria. Clinical studies have shown that zinc supplementation can reduce the duration of respiratory infections and improve immune response. Foods like nuts, seeds, legumes, and whole grains are excellent natural sources. Now, let's talk about garlic. Garlic has been used for thousands of years as a natural antimicrobial, and modern science confirms its power. Garlic contains allicin, a compound with antibacterial, antiviral, and antifungal properties. Research shows that garlic can stimulate immune cells and reduce the severity and frequency of infections. Adding garlic to your meals is one of the simplest and most powerful steps you can take to protect your lungs. Ginger is another ancient remedy backed by modern science. Ginger contains compounds like gingerol that have anti-inflammatory and antioxidant effects. Studies show ginger can relax airway muscles, reduce inflammation in the lungs, and help clear mucus. A warm ginger tea can soothe irritated airways and support breathing during infections. Turmeric is often called nature's anti-inflammatory powerhouse. Its active compound, curcumin, has been shown in research to reduce inflammation, fight oxidative stress, and support immune function. Chronic inflammation weakens the lungs and immune system, making infections more severe. Adding turmeric to food or warm milk can provide daily protection. But it's not just about individual foods. It's about the overall pattern of what you eat. Diets rich in fruits, vegetables, whole grains, and healthy fats provide antioxidants that protect lung tissue from damage caused by infections, pollution, and smoking. These antioxidants neutralize free radicals that can destroy lung cells and weaken immune defenses. Hydration is another powerful but underestimated weapon. Water helps thin mucus in the lungs, making it easier to cough out bacteria and viruses. Dehydration thickens mucus, trapping pathogens inside your airways and lungs. Studies show that proper hydration improves respiratory function and speeds recovery from infections. Warm fluids like herbal teas and broths are especially beneficial. Here is a shocking fact. Malnutrition and dehydration can double the risk of complications from pneumonia. In hospitals, doctors often focus on fluids and nutrition as part of treatment because the body cannot fight infection without fuel. Now, how do you use this knowledge in daily life? It doesn't require expensive supplements or complicated routines. It starts with simple habits. Begin your day with warm lemon water to hydrate and provide vitamin C. Add garlic, ginger, and turmeric to your cooking. Eat at least one serving of fruits and vegetables with every meal. Drink water regularly throughout the day. Spend time in sunlight for vitamin D. These habits are not just for when you are sick. They are for every day, because when infection strikes, you do not rise to the occasion. You fall to the level of your preparation. Research shows that people who maintain healthy diets and lifestyles have stronger immune responses, fewer infections, and faster recoveries. The immune system is like a muscle. Use it, feed it, and strengthen it, and it will protect you. Neglect it, and it will fail you when you need it most. Another powerful factor is sleep. While you sleep, your body produces cytokines, proteins that help fight infection and inflammation. Sleep deprivation weakens immune defenses and increases susceptibility to respiratory infections. Combining good nutrition with quality sleep creates a powerful shield against disease. Stress also plays a critical role. Chronic stress suppresses immune function and increases inflammation, making infections more severe. Relaxation techniques, breathing exercises, and mindfulness can help regulate stress hormones and support immune health. The lungs are exposed to the outside world with every breath. Pollution, smoke, viruses, and bacteria enter daily. Your immune system is the gatekeeper. What you eat, how you sleep, and how you live determine whether that gatekeeper is weak or powerful. Pneumonia does not only strike randomly, it often takes advantage of weakness. Poor nutrition, dehydration, stress, and lack of sleep create that weakness. But the opposite is also true. Strong habits create resilience. Imagine your immune system as a fortress. Every healthy meal strengthens the walls. Every glass of water fills the moat. Every night of good sleep repairs the defenses. When infection arrives, it meets a powerful barrier instead of an open door. Science is clear. Lifestyle and nutrition are not optional extras. They are foundational medicine. Doctors treat pneumonia with antibiotics and oxygen, but prevention begins with what you eat and how you live. Your body is capable of extraordinary healing. Your lungs can regenerate, your immune system can adapt, but it needs support, it needs nutrients, it needs care. Every meal is a message to your immune system. Every choice is either strengthening your defenses or weakening them. And when it comes to respiratory infections, those choices can be the difference between mild illness and a life-threatening emergency. You have more control than you think. You can build an immune system that stands strong against chest infections and pneumonia. You can protect your lungs, your breath, and your life, one day, one meal, one habit at a time.